Hello everyone. Welcome to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Bethlehem, and I will serve as your session moderator. I am joined by Sumia, who will serve as our technical host. This session is being recorded. Transcription is available through the Zoom platform. And should you have any questions or comments, please feel free to write your questions in the chat. And now I'd like to pass it over to the speakers, Callie Silver and Elise Schemberger, who will be presenting their digital poster with the group.
All right, I'm Elise, and I'm a grad student at UIC. And I guess I'll just dive right in. So for those of you that are not aware, in 2018, Illinois passed legislation to prohibit early childhood exclusion across a variety of early childhood settings, including kind of home-based care, center-based, and school-based programs. And in this legislation, they specify mental health consultation as a viable prevention option to reduce expulsion. And this poster presents data from a longitudinal implementation evaluation of programs' understanding of and response to this legislation. And so this is a survey, this data is from a survey that's been sent out for the past 4 years and asks program administrators about their expulsion practices as well as various aspects of just their program characteristics. So asking about kind of funding, staffing, enrollment, as well as access to and use of mental health consultation and other resources, as well as their use of exclusionary discipline over the past 12 months. And so what you'll see here in this first upper left graph here is that expulsion rates have kind of overall initially declined. You kind of see this 12.5 per 1,000 kids enrolled before the excluded before the legislation, and that jumps down to about 3 per every 1,000 children enrolled. But what we'll see is that rate stays fairly similar over time, and so this practice still continues. And what we're seeing is that children are excluded in other ways more frequently. So we're looking at a couple of different types of exclusion, the kind of standard expulsion, telling your kid that they can't come back to the program, as well as a couple of what we call softer forms of exclusion, including withdrawal, where the parents are kind of encouraged or coerced to withdraw their children from programs, as well as transitions where programs are hopefully setting children up in a program that has more resources or can better support those child's needs. And what we're seeing over time is that this group of children who are transitioned is really increasing quite a bit. So you can see in this last iteration of the survey, this darkest blue bar, those transitioned kids, that third blue bar there. And those are really increasing over time. So if we pivot to programs' use of mental health consultation, you see not even 40% of programs are reporting using these services. And for the most part, folks are citing that they don't need it. And then you have another smaller 15 to 20% of programs that are haven't heard of it or are unsure where or how to access these services. Now, of the services, of those that do use the services, what we're seeing are a lot of reflective consultation, there's observation and screening, some meetings with families, they're providing strategies for tracking challenging behavior. What's notable here is what we're not seeing is a large portion of these programs choosing to receive implicit bias training from the mental health consults. And I'll come back to that in a bit. So if we but for those that do work with a consultant, we are seeing that they exclude a smaller proportion of enrollment. And this is what we would want to and expect to see when programs are able to use this prevention measure. And if you look on this lower right portion of the screen, despite the fact that those who work with a consultant exclude a smaller proportion of their enrollment, what we are seeing is that Black children are excluded more often from programs receiving consultation than those that do not. And there's a lot of ways that you could understand that. One could be that despite using this mental health consultation, they are not using implicit bias training where they could. And what I will say as a slight caveat here is that the demographic data was inconsistently reported. So kind of take these numbers with a grain of salt. And also it's likely that these are potentially an undercount of disproportionality data. So those were our kind of big bucket findings from this year 4 survey. Lots to think about. And the hope is that other states can kind of use this data to help navigate some of their barriers and continue to work to use mental health consultation as an effective prevention strategy for early childhood exclusion. So I'm happy to answer any questions that folks might have.
Thank you guys for sharing this information. I would welcome, I guess, hearing a little bit more about the underutilization that you were experiencing and just what you were saying about some of the cited reasons for that. I appreciate some programs acknowledge like not appreciating or being aware that consultation was happening, but just more about kind of what you're noticing in the underutilization and how you guys may have worked to address some of that, because that is definitely what we're experiencing in Wisconsin as well. And, definitely interested in creative strategies for how we can address that and help get more programs utilizing the service.
Yeah, so I'll speak, I suppose, more anecdotally. We do have some qualitative data from this survey that we haven't kind of formally analyzed yet, but it seems like a lot of teachers are stuck in this position of really needing an intervention strategy, and with mental health consultation being a really great prevention strategy. So it seems like a lot of programs are just feel like they're kind of on fire, especially with COVID. And it's really hard to implement, systemic prevention measures when everything is currently in crisis. So I would expect that that's part of it. And my understanding is that, there aren't enough mental health consultations or consults to go around. And there's, some folks that are responsible for a wide number of schools. And so I wonder if, the wait times to kind of get access to these services are quite high right now. And if that might be a portion of it, although it does say, only 10% are citing wait time as the primary reason for not using services. But yeah, Callie, I think let you answer if you have anything else to add.
Something that is like a little bit, that is, I guess, promising is that you see here the percent of reason for not using consultation for this 4th year of our survey was at around 21% for folks who had not heard of it. The first year we ran this survey about 4 years ago, it was around 50%. So we really, you're seeing that like, at least, well, at first we were like, okay, people just don't know that this is around, or they don't really know what this is. And so I'm comforted a little bit that, our movement towards just letting people know that this is a resource we're at least, making a little bit of progress there. because I think it was concerning because Illinois does have a statewide mental health consultation program like many other states. So, technically everyone is eligible and they're eligible to receive this service for free. And so we were, concerned years back when we were hearing that like nobody really knew about it. And so I think continuing to work on sort of that public awareness piece of it. And then also, the second one, unsure where or how to access it. I think that kind of goes hand in hand with, just wanting folks to know that this is something that they have, access to. Think, and there are certain ways that we kind of partnered with, or not we, but the mental health consultation program has partnered with, kind of the local CCR&Rs to try to get the word out a little bit more. But I think, we're running up against the challenge of, wanting to publicize this as a resource, but then also knowing that our mental health consultants are already overburdened and, are already serving so many programs. And so it's like, we want people to know about it, but we also don't want to, not be able to meet demand.
Yeah, I think, knowing the relationship-based nature, and for all of us, that consultation, ideally works the best when it can be preventative as well. Am I hearing then part of the challenge is with just like the workforce being spread so thin that they're really only able to connect with programs when it is more responsive to a child's specific need or the challenging behaviors? Or I'm curious if you've been able to like adjust some of the model a little bit where we are, you are connecting more proactively and maybe doing some of, because I see you have like professional development and all of these different things, and I guess I might have missed it, but whether a lot of that has been in response to when the program's trying to utilize to do that with so many programs.
Yeah, I mean, I think we're still seeing that like in Illinois, the model tends to be, in response to a particular child or a particular situation. In an ideal world, mental health consultants there'd be enough that they'd be able to do outreach and sort of like these proactive PD services, but we're finding that PD is really coming as a result of, that initial like ask. And that's still, a workforce thing of like, if there were more to go around, maybe that would be different.
And we have a question in the chat from Laura. So if either Callie or Elise want to address it, it says, could the higher rate of Black children being excluded from programs receiving consultation be correlated with the rate of tier 3 behavior those programs are experiencing?
Yeah, I think there's a lot. So I'm not familiar with the different tiers of behavior. I gather from the question that that's sort of, more severe or more difficult behavior to manage. But yeah, there's certainly, a caveat that those that are requesting consultation may be in, a more desperate state of having a kid that they don't know what else to do, and kind of calling on mental health consults as an intervention strategy. I do think it's still kind of tricky though, because you do see lower rates of exclusion with the consultation, but you don't see that across all demographic groups of kids. So certainly there's lots of context here that certainly could be a factor. And I think it just, requires a deeper dive into this question specifically. Especially since we had a tricky time getting kind of consistent reporting of some of those disproportionality data as well.
Thank you. And I'm sorry, I didn't hear the very beginning of what you were saying, but did you also take into account the race of the consultants and the teachers?
No, so these were the folks that filled out the surveys were program administrators. So they were just reporting on the demographic makeup of their kind of overall students enrolled, and then the demographic makeup of those who were excluded. Excuse me, but we don't have information on the race of the teacher or the race of the consultant.
Yeah,
Okay,
and
thank you.
and there, it's something that we've been thinking about. I mean, the literature does, suggest that that is an important factor, so I guess we've been challenged every year in collecting data around race and ethnicity. Every year we've asked it in like slightly different ways to try to increase response rates, but we still, are missing data for anything having to do with race and ethnicity has been really high. And that I think is an interesting finding in and of itself. And so we've been really trying to think about ways to, get that information. And also, like, as we mentioned, this has sort of been a response to the statewide legislation, and we've been collaborating with state partners, but this is not necessarily like a required survey that folks have to fill out that's tied to any of their funding or resources. And so I think our goal would be that it is, so that we can collect that information a little bit more fully.
Thank you.
Yeah. I'm looking at Katie's question in the chat. Yes, so you are correct that the way we all kind of had to become somewhat of legal scholars through doing this project, but the way that the legislation works is that, the legislation is passed. So Illinois Public Act 100-105 was passed back in 2017. And then there's a process of rule writing, which basically takes the law and it, kind of operationalizes it and really picks apart what has to be done. And so the two agencies, DCFS and ISB, are still working on this rule writing process. So we'd be able to that are associated with the law. Those are still being written and being revised. So the confusion is definitely warranted because those rules will sort of be the action code book that you're looking for. But we can definitely send in the chat what currently does exist.
If anyone else has questions, please feel free to jump in or put them in the chat. And if there's anything else Elise or Callie wants to add, please feel free. I like this awkward silence a bit, but I'm joking. I know it's a lot of information and process. It's a really great presentation. So thank you, Callie, Elise. But if you have, okay, yeah, there's a question in the chat. So go ahead.
So this is a really interesting question. We didn't ask kind of specific amounts of time that folks had used the consultation for in the survey, I don't believe. But certainly, you know, an ongoing kind of established relationship with a program could certainly have additional benefits rather than kind of a one-time visit. So I think that's something, yeah, to definitely think about going forward.
Yeah, I know. Yeah, so I'll just reiterate that like this wasn't a you know, sort of like a formal randomized control trial or, you know, formalized intervention where, you know, every program was receiving the same thing. This was sort of like following the model of Illinois where it's like, you know, an as needed sort of thing. So it does really vary.
So again, please feel free to write your questions in the chat or just jump in and talk. We still have about 8 minutes left, so you have time to think and really get to ask Callie and Elise your questions.
So I guess, where are they going to go from here? I know they're going to use this data to help other states. I'm here in Colorado, and I know that the expulsion rates are still high everywhere. But what does it look like moving on from here with this data?
Yeah, so we've continued to you know, be in close contact with our you know, state policy partners at the governor's office as well as other state agencies. And you know, especially when it comes to knowledge of mental health consultation, that information has been really helpful. And you know, really kind of this bi-directional process of, you know, us continuing to collect data and have it go back to our state policy partners to kind of inform their rule writing process and, you know, the gaps, because, you know, passing legislation is one thing, but the implementation is another. Like I said, also, we are really trying to have this be a more formalized statewide survey. This has been a convenience sample, and this has been sort of like, you know, a stopgap measure in a lot of ways. And so we're really trying, and the legislation does call for systematic data collection. So we're really hoping that that's kind of the next step of data collection. And then I'll also address Ashley's question. It's a really interesting question. How has the underutilization and citing of no need been contextualized for funders? So I think that we've interpreted a lot of this as, again, sort of a lack of understanding of maybe what mental health consultation is and what it can provide, especially, you know, for folks that did expel a child and said they didn't have a need for mental health consultation. That sort of demonstrates to us that maybe there's a lack of understanding about what this is and what it can do for a program. So we're really trying to kind of work on, you know, that sort of messaging around, again, like, you know, this isn't a resource that you have access to, and this is what it is. Because I think I interpret no need as maybe don't understand if I've expelled a kid. Let's see. And so, okay, so there's some questions about the advertisement of the program. And yeah, I think so. They are, the program is advertised. In Illinois, the program is called Caregiver Connections, and they do kind of, I'd say all of the above. You know, they say, you know, like, are you having problems with a specific child? Are you like wanting to improve the social emotional environment of your location or your early childhood setting? And I'd say that, you know, ideally, like one day it would be, you know, are you just thinking about, you know, the context of social emotional, but I think to kind of like grab caregivers who are really, stretched thin, and like kind of tapping into their immediate need gets them on board. So I'll put the link in the chat. This is it, like kind of how the language that is advertised to folks. And again, this is a statewide system, so state funding. And they like, and we're not necessarily part of the delivery of these services.
And there's another question in the chat from Ashley Bowers. Has outreach efforts been made to target families with this information? And she explained it a little bit more. So
yeah, so this is a good question. And I think that we've talked about this, with our state policy partners, and making sure that they know that like this is something that they, have access to. I think, the way it typically works is that like the center or the program is the one that's sort of initiating this resource and then getting the families on board. But I do really actually like this kind of reversal of the pattern, with starting with the family, and kind of letting them know what they have access to. So that's actually something that I would like to bring back to our state partners as sort of like, how much are we doing with family outreach and education around mental health consultation. And then just back to Laura's question about Head Start programs. So there are Head Start programs included in this sample. They would likely not be using sort of the state model of mental health consultation because they sort of have their own network, where a lot of them have in-house mental health consultants, or they're sort of privately contracting with folks. So it's probably a different set of mental health consultants that they're using, but they were not excluded from this study.
Thanks. To me, it's, I just wonder how it impacts the data because it's already such a known thing in Head Start programs. And, it's been in mental health consultation, has been a part of it for so long. So yeah, it's very much a different thing in Head Start compared to other systems. I'm in Oregon, where we don't even have a statewide mental health consultation program yet. It's just in the process of being designed right now. So it's very much unknown to pretty much all programs except for Head Start here. So the data from Head Start programs will look very different from data coming from anywhere else. So I would be curious.
Definitely.
What the
And
data
I think we
like.
have in previous years, disaggregated the data by Head Start programs. We've never had an overwhelming number of Head Start participants in the study. So it's kind of hard to say, but I do agree that, they would have a higher level of understanding.
Yeah. Sorry, I'm a behavior analyst, so data just makes me go crazy. So I'm always, I'm always looking at different things like that.
No worries. Thank you, Ashley. That's exciting to hear about your work in Milwaukee.
So we have about a minute left. So if there are any last remarks or any questions you want quickly addressed, please feel free.
Well, thank you all for attending this today. And Elise, thank you for presenting our work, and for all of your interest. We're definitely open to staying in touch about any of these topics. So you can reach out to Elise and I on the platform, and we'll just pop our emails in the chat as well.
Thanks, everybody.
Thank you.
Yes, thank you for joining everyone. And thank you, Callie and Elise. Thank you for your presentation.